Good evening. Welcome back to the next edition of Dr. Twyman's Ask Me Anything, where I help you reduce your risk of having a heart attack or stroke. So, as always, you guys submit some good questions. I answer for you, send you back out on your way in less than half an hour. So, hope you guys are having a great week so far. I got a couple more days in the office, and then I'm off for an adventure to Japan for a couple weeks. So, I might be out of network range quite a while when I'm gone, but I'll take some pictures and post them when I get back. So, I'll fire up some questions here. So first question of the night, does eating meat contribute to heart disease? Short answer is probably not. Very rarely, unless you have certain genes that affect your metabolism of fats. It's usually the saturated fat that comes along with meat that's the problem. So most time, not a big concern. But again, I'm a big proponent of test, don't guess. So test your arteries, test your labs, and then know what you need to do to optimize. But animal-based meat can be a good source of protein for people. Without protein, you're not going to have good skeletal muscle. Without good skeletal muscle, you're not going to have a good metabolism. So the short answer is probably not heart disease. Our ancestors have been eating animal-based products for eons. All right, here's a question about Ben Greenfield recommending a heart stack collab with Vital Boom. I have not seen the stack that's included with that. I'm not a huge proponent where people would have a one-size-fits-all type of a vitamin stack. And also it completely depends on certain nutraceuticals if you're going to use. Brands matter. I suspect they're probably using high-quality brands, but sometimes it's very specific what you need to use, particularly for things that affect vascular health, including things that affect nitric oxide. There's a lot of nitric oxide promoters out there that don't actually work very well. So you have to know what you're looking for. So possible, but I'm not a big believer that you can have a one-stop shop for some of the stuff. You have to do the testing, figure out what the person's deficient in, and then optimize those directly. And I know they do some lab type of testing, but I'm not sure if they're doing all the advanced testing from like Boston Heart Lab or Cleveland Heart Lab to really find out what exactly you may need. With family history of heart disease, what age to first see a cardiologist? This is a great question, and I often get this from patients who we find some genetic markers, and they ask when they should have their kids checked. There's no hard and fast rule, but sooner the better. There's certain vascular diseases that can promote early vascular disease in the your 20s or 30s. So if you have familial hyperlipidemia, you should start screening kids. I believe it's like under 6 years old, if you have a history of homozygous familial hyperlipidemia. But a short answer is most time 18 is probably a good starting point. Know how good your blood pressure is at that point, your body composition, your insulin sensitivity, your ApoB lipoproteins. You can check the lipoprotein A one time. If it's high, you're at higher risk. If it's low, you'll never have high levels of Lp(a). So 18 is probably a good starting point for many, but you can start younger. Can I skip chicken and all other types of meat to have a healthy cardiovascular system? Yes. I usually tell people that I really only have kind of 3 rules for nutrition to start, then everything else is based off of what your goals are. But initially, it really matters on what your maternal haplotype is, because what kind of mitochondrial engines do you have? That determines what kind of fuel source you're generally going to work on better. Then where do you live in the world? Do you live in somewhere where you're near the equator? Do you live somewhere at a northern latitude where the ground's frozen many months of the year? That determines what foods you're optimized to eat. Short answer is, if you had ancestors that were living exactly where you're at right now and it's 200 years ago, what would have they been eating? That's the diet that you're optimized to eat. Can you eat a vegetarian or vegan based template and still have a healthy cardiovascular system? Yes. Just takes more planning. You got to get your B vitamins, iron. You have to get enough protein through lentils, beans, soy. It's possible, but you got to do a lot more planning because plant protein is less bioabsorbable than animal-based. So I have seen people do it, but it is challenging. Broad question: what causes plaque in the arteries? It starts with oxidative stress, inflammation, autoimmune dysregulation. Those are the 3 finite responses that the arteries can have happen. This was something that was taught to me by Dr. Mark Houston many years ago. Infinite insults. So heavy metals, plastics, high insulin, stress, high oxidative lipoproteins, infections. Many, many things can damage the glycocalyx, which lines the artery, and that opens up the doors to plaque forming. So you have to go do the assessment. Okay, what's in your local environment? What's in your blood? How well do you respond to those things by making nitric oxide? So there's tests that can stress your arteries to tell you your arteries responsive to your environment. So that test is called the endopet scan. And then you can go looking for plaque. So if you have an abnormal carotid intimal medial thickness scan, CT coronary calcium scan, CT coronary angiogram, the more plaque you got, the more risk you have cardiovascular events. That's when you want to be much more aggressive with your lifestyle interventions, your medications, and your supplements. All right, so it says they stick to meat and vegetables and eggs. Their blood pressure is controlled. But if I eat anything with sodium, my blood pressure spikes, and I think I can take herbs that can help with that. So some people are more sodium sensitive than others. The endothelial glycocalyx buffers sodium. So if you have a healthy glycocalyx, you generally can tolerate more sodium. There are certain genes that, if you have issues with aldosterone hormone makes you hold on to more sodium. That's holding on to more water. That dilates your arteries and raises the blood pressure. So for people who, if they tried to restrict sodium, but blood pressure is still elevated, and they've tried different lifestyle interventions or herbs or supplements, generally the best medication is going to be aldosterone blockers such as spironolactone. Somebody says they have a 3-foot tall OptiGlow red light therapy and near red light therapy. They've heard me talk about red light therapy and infrared, but not near infrared. So let's see, I think that this question extended on. Does near infrared therapy help too? And if so, use it at the same time. So I've definitely talked about these in the past. Sometimes I have to kind of break it down to be able to explain it in terms where people can understand it. I sometimes use an analogy that, think about, AM radio and FM radio. They're different frequencies, and your body's tuning into those different frequencies. So the data on near infrared is that it's going to be more about the structured water or the coherent domains in your system. Think about infrared as charging up the water batteries in your system. Where red light therapy is more about actually directly affecting the cytochrome C oxidase in the mitochondria so that it increases energy flow by liberating nitric oxide from the 4th cytochrome. So both are beneficial, but they work a little bit differently. Now there are some theoretical differences between near, mid, and far infrared, but that's for another conversation. The infrared will penetrate deeper into the tissues, so maybe a little bit more beneficial for musculoskeletal injuries by decreasing pain and decreasing inflammation. Can you use them at the same time? You can, but I would not use a sauna that also has a red light panel. Those wavelengths don't need to be combined at the same time, and you want to do those generally separate. So I would do red light therapy panels first, and then do a sauna if you're going to do them, back to back sequentially. But Mother Nature is wiser than humans, so you want to get the right wavelengths of light. Sun up to sundown, the sun is going to have those wavelengths. What's my opinion on someone taking spirulina and chlorella? Generally neutral. Theoretically it helps with certain heavy metal, detoxification pathways, but no real concerns for most people taking them. But I haven't seen them actually do all that much for people's heavy metals. All right. If we eat very healthy but too much, can it increase fat and plaque? Absolutely. Food is not only energy, it's information to the system. Tells you what time of day it is, tells you what season it is. If you overeat for your body's metabolic needs, you'll store it as fat. And depending where the fat is stored, if it's visceral fat, it's going to have more cytokines, more inflammation. That inflammation can then damage the glycocalyx in the arteries, and you're more likely to build up plaque. So healthy food is, kind of a baseline. You want to eat whole foods, but too much can be a problem. When you're eating food, you have to use oxygen to metabolize that food, break it down into its components where you're then going to have the electrons and protons floating, or say, transporting through your mitochondria. So you got to breathe oxygen to metabolize those things. If the oxygen escapes from the mitochondria, that causes free radical damage. So causes smoke essentially. So eating food is a issue with oxidative stress. So I've been told before, atherosclerosis is a postprandial event. So eating food increases the gut lining's ability to leak lipoprotein saccharides. The LPS can damage the glycocalyx and drive more vascular inflammation. So somebody says, if the endopat test is okay, should I continue taking M101? Well, it would depend on were you on M101 twice a day before the endopat, and that's why your endopat test was normal, or was your endopat low, you started M101, and then the endopat normalized. So if it normalized with M101, you probably should continue taking it. Now, if you fixed the lifestyle things that were causing you to have low nitric oxide, you were using Listerine, you were not getting proper sun exposure during the time that UVA light is out, you're not exercising. If you fix all the pathways that broke nitric oxide, then possibly you don't necessarily need it anymore. But the endopat is just one test. You have to look at, is your blood pressure normal, your arteries elastic, look at biomarkers. Do you still have a lot of oxidative stress or inflammation? So it's something that, not saying that, once you start, you can never stop, but you have to make sure that you fixed all the things that were broken to begin with. So I think I already answered this person's question about their sodium. So if you couldn't tolerate spironolactone, you'd have to work with your local doctor to figure out what might work best for you then. You probably need some genetic testing. The cardiac panel can kind of help with that. It's from a company called Vibrant America. Would I consider Hawthorne supplements beneficial for heart health? Possibly, but you need to make sure that you have some normal kind of renal function and electrolytes before playing around with that supplement. So I won't comment on the one about the cancer, but our coronary disease, an infectious disease, there's a place where some of the plaques will be more likely to grow if you have periodontal disease. So all my patients know that I ask that in my questionnaire. When's the last time you've seen your dentist? Do you have any periodontal disease? Are you on any type of medications for oral health? Because if you have oral disease, there's definitely been, coronary plaques that, have been aspirated out, and then they find the bacteria that come from the oral pharynx inside the plaque. So, the glycocalyx for sure can be damaged by, infectious diseases. How does having high lipoprotein A relate to having high risk of heart attacks? Lipoprotein A is an ApoB containing lipoprotein that increases the risk of atherosclerosis because it's more atherogenic and more thrombogenic. So in English, it's more likely to cause plaque in the arteries because it's protein on the outside of it. The apolipoprotein A is more likely to basically stick to the glycocalyx. And then it's more thrombogenic, so it's more likely to cause the blood to clot. So that's how it increases the risk of heart attacks and strokes. I don't know really what checking blood means. Somebody says that they bruise very easy. Is it worth to check their blood since they're taking 81 milligrams of aspirin? So I don't know if you mean is it you're trying to check your blood for platelet aggregation factors, or you're just saying, is it risky to check blood while on aspirin? If it's the latter, no. I mean, I used to be an invasive cardiologist. Our patients were anticoagulation during CAS, and we were taking blood out of their coronary arteries during some of the tests. So no, it's not necessarily that risky, but it would really be kind of a follow-up question like, what blood are you looking to get checked? All right, so it's a good question about the calcium score. So they have a calcium score of 0 at the age of 60. Outstanding. The goal is to have a calcium score for as long as possible at 0. If you live long enough, oftentimes calcium score does become positive, but you want to be later in life, not before 40, which I've had some patients do that. How often should you continue to get the test? Generally every 3 to 5 years if your score is 0. But just because you have a calcium score of 0 doesn't mean that you don't have soft plaque somewhere else. So you may want to consider a carotid intimal medial thickness scan, or later a CT coronary angiogram if you really have a lot of risk factors of vascular disease or strong family history of vascular disease. You don't have hard plaque that can get picked up on a test, but that test is not looking at the soft plaque. Then it's more than half the time people have heart attacks, it's the soft plaque that ruptures causing that. So, any recommendations on how to remove microplastics from the body? Great question. I don't think anybody has a great answer for that at the moment. The goal is trying to minimize the exposure. So, drinking out of glass containers, not keeping food in plastic containers as best as possible. It's the elimination from your intake than it is once it's in the system. I'm not seeing great data that sauna therapy really helps you eliminate it. So, what are my thoughts on fasting? Can it help the heart? On occasion, but really depends on what the goals with fasting are. The consideration is, if you're not eating enough protein, you might not be able to keep up your skeletal muscle mass optimally as you age. So I'm not a big fan of people doing extended fast unless they have a very clear goal and they're working with a physician on why they're doing that. All right, so I think I got through all the comments there as well as the questions. So waiting for a few more data to trickle in. So I wanted to let you guys know that this will probably be my last AMA for a couple weeks. I might try to sneak some in, but I'm going to be traveling to Japan for a couple weeks on a well-deserved break. Go do some forest bathing, go see some sights. So I think I'll probably be off the grid for a little bit. So I will take a lot of pictures, and then I'll post some of them when I come back. So I will get back on the schedule when I'm back. I'll be back by the end of the month. But any of my kind of archives for these Ask Me Anythings, they're going to be up on my YouTube channel, which is just drtwyman.tv. So you probably noticed that if you go there, I'm starting to use a little bit of the AI tools to kind of pull out the description so you can kind of skip ahead to find the questions that you're interested in looking at. There's probably 4 to 5 years of archives of Ask Me Anythings up there on the YouTube channel. So, all right, guys. Well, I don't see any other questions coming in for the moment, so I'll let you guys have a good rest of the night. Hope you have a great rest of the week, and I'll see you when I get back.